Hi everyone, I am Dr. Sakarsav and welcome to Vet Surgery at Age. So today I welcome you to the first lecture in the series Regional Surgery. It is in your course, that is Veterinary Surgery and Radiology, prescribed by the ICR VCI. Okay, so today we will be dealing with the surgical affections of lip, tongue, palate and cheek. Before going to the lecture, some formalities. Do follow me in the Facebook. I post different surgical conditions that has been operated by me. And in Instagram, this is more important than Facebook. I post all the notes and also the update regarding the videos. And one announcement, I will be sharing the PPTs of these classes, especially the series Regional Surgery, in the link, as well as the books which I have the link I will share in the description, but I will not be sharing the notes because you see notes take a long time for me to prepare, because I have to write it down, then I have to make PPT. It takes long time, and recently I have some more responsibilities coming. Now I am married, so there are different responsibilities coming, so I will not be getting much time to make notes for you, so sorry for that, but you can make your own note during the class and I will share the PPT in the description. Okay, so these are the books which I am referring for preparing the lectures of regional surgery: the farm animal surgery by Elsewhere, small animal surgery by Elsewhere, ruminant surgery, essentials of veterinary surgery, and dollars veterinary surgery. These 5 books I am referring, and from that I will be making the notes. And regarding remember that in this lecture mostly it will be focused on pet animals, dog and cat, but whenever there will be some conditions which is specific to large animal, I will mention about that, and if there is some difference between the pet animal and large animal, I will also point it out. Remember that the surgical techniques for pet animal and large animal is not that different. Technique is same, only thing is that the anesthetic protocols will be different, the suture material that will be used will be different. Okay, mostly these two, and some instrument which may be specific to large animal and a small animal, but basically the technique will be same, or the surgical procedure will be same, only some variations. Okay, so the first, some anatomy. You see, you have anatomy book, you can refer. I will be telling some minimal points which you have to remember because we will be dealing some surgical affections. So this is the anatomy. First, you know that this is philtrum, the separation, the philtrum. These are teeth. Okay, this is canine teeth. This particular portion is the hard palate. This is hard palate, and here is the soft palate. This is soft palate. Okay, this is hard palate. This is soft palate. And you see this particular region, this junction is known as the vestibule. This is vestibule. And remember this arch here and here, this arch is known as palatoglossal arch. Okay, next this is tongue, and this is this membrane which attaches to the ventral surface of tongue is known as frenulum. And below the tongue you will find 2 caruncles, sublingual caruncles. These 2 sublingual caruncles. Here the sublingual salivary duct will be opening. This is important when you will be dealing with the ranula. Okay, this is sublingual caruncles. These are incisor, canine, premolar and molars. These are teeth. Okay, this is basic anatomy which you know. There are some more anatomies, more things, but these are the basics. First surgical condition is lip laceration. Lip laceration is mostly commonly will find in pet animals by animal fighting. In large animals you will find mostly due to either bitten by dog, okay, or sometimes due to their grazing behavior, they may come in contact with sharp nails, which may injure the lip, causing lip laceration. Or you may find that sometimes during pica behavior, when they bite inanimate objects, you will find this lip laceration. Sometimes they may bite the barbed wires, where you will find this lip laceration. Okay, here it is a picture of lip laceration. You can see here the lip is lacerated, and the surgical procedure simply suture it, nothing else. Okay, so while doing the suturing, how good you are, how fine you can do the suture depends on your experience and your expertise. Some surgeons has good hand, they can do better reconstruction of those lips. Simply you have to suture it. Next condition is lip avulsion. Lip avulsion, similar to that to lip laceration, serious form is lip avulsion. You may find in case of pet animal by infighting, or in case of large animal by biting. Okay, biting or during jumping barbed wire, it may cause lip avulsion. Lip avulsion is basically means that it is separation of lip from the bone, Okay, it can be upper lip, it can be lower lip. So in upper lip it will be separated from the maxilla, in lower lip it will be separated from the mandible. You see, most commonly you will find lower lip laceration. Okay, lower lip laceration. Remember, when you will find lip laceration cases, remember that you have to see whether there is any soft tissue left. Okay, you have to look for any soft tissue left for suturing. Soft tissue left. If there is some soft tissue attached to the bone, suppose in this particular case, if you will see, this is the mandible, here is the mandible, here will be the mandibular symphysis, and the lip is lacerated. This is lower lip. Okay, the lip is completely lacerated. So when the lip is completely lacerated, there isn't much soft tissue here, particularly here. Okay, not much of soft tissue. If there will be soft tissue, simply soft tissue to soft tissue suture. Okay, if there isn't enough soft tissue, then there are two techniques what you can apply. You can involve the bone by drilling holes, you can suture it to the bone, or you can attach it to the dental or incisors, or specifically or broadly teeth. You can take bite along with the teeth, or you can loop around the teeth, so that this soft tissue will be in contact with the bone. Okay, so here you can see, here there is a big laceration, you can see after freshening. Then you can see it is here the bone is bite is taken through the bone by drilling holes. Okay, now some retention sutures, then after suturing, simply sutures, simple interrupted pattern, or you can use continuous. The disadvantage, because they are animals, if there will be one cut at any particular point, then whole suture is gone. But when you will be applying simple interrupted sutures, then if one is cut, still others will be intact and there will be healing. Other will heal by primary intention, and the portion which has been cut, it will heal by secondary intention. As simple as that. Here you can see, here there is a case, there is also lip lacerations. Here they have done the suturing. Remember, when there will be extensive lip laceration, then there will be build up of edema fluid or any fluid accumulation. So what you have to do, or blood or any transudate anything, it can be accumulated at the ventral surface. Okay, so you have to put a drainage catheter. It depends on how the conditions are, how many days have passed. If 3-4 days, then it is going to be septic and there will be accumulation of some fluids and there will be some problems. So on your experience, and on it is up to surgeon how he or she will deal with it. Okay, the basic principle is you have to suture it to the bone. So you can do direct suturing if soft tissue is there, otherwise you can take the help of bone and teeth. Okay, let us see some images actually how you can take. You can see here there is lip laceration. Here a loop around the teeth while suturing can secure the soft tissue. Otherwise you can go for the bone drilling. Here 2 holes has been drilled, then suturing. Okay, and here is the placement of a drainage catheter. Okay, you can drill with the bone, you can take a loop over the teeth, or you can directly suture if there is enough soft tissue. Okay, You can use both observable and non-observable sutures. Non-observable sutures you need to remove it, but if you are using observable suture, don't use catgut. You can use either Vicryl, which is polygalactin 910, or you can use PDS. PDS is the best one because it is not that braided. It is monofilament, so it causes less injury. Next surgical condition is cleft lip. Cleft lip. It simply means it is a congenital defect. There will be cleft over lip. You can see in this picture. You see here there is a cleft lip. This is a cleft lip. Here in a puppy, you can see on both sides there is cleft. Okay, cleft lip. Most commonly, it will be found along with cleft palate. We will discuss cleft palate later. So cleft lip and cleft palate, they are congenital defects. Cleft lip, the surgery is basically Z-plasty. The surgery is known as Z-plasty. Z-plasty. Plasty simply means plastic surgery. Okay, where you will be using different flaps, other techniques. So Z-plasty, how to do Z-plasty? Here you can see here cleft palate. So you have to make two flaps. This is the nasal flap. This flap is the nasal flap, and another one is the buccal flap. Buccal flap. Why? Now you have to join this nasal flap to buccal flap. Why? Suppose you have not done the flap here. Suppose you have not done the flap and you simply oppose the skin. The purpose will not be solved because below the skin still nasal and oral cavity are connected. Okay, so it will not solve the problem. But if you are making two flaps and joining, then this will act as a barrier between the nasal and the oral cavity. Okay, understood? That is why you need nasal joining of nasal flap and buccal flap. You have to join. Then after you will do the Z-plasty. So you have to make incision A to B here, then here A to C, like this. This particular portion, what you are seeing, this particular portion, this will be like, when it will come, it will go in between this. You can see here. Now AB incision, it is separated. Here this particular flap which you have made through incision, it will go inside. Okay, it is like this. It is more like S, but it is known as Z-plasty. So it will go inside like this and it will be sutured. Okay, this is Z-plasty to for this surgery of a cleft palate. Depending on how severe it is used. Next question, surgical condition is traumatic tongue injury. Okay, it can be of various origin. Okay, maybe due to fighting, maybe due to biting some objects like this. Most of the oral injuries are from fighting or traumatic origin. Okay, maybe chewing the barbed wires or maybe while grazing in large animals, while grazing they may eat some having plants having big thorns, then there will be lacerations. Okay, so you will get traumatic tongue injury. If the basic principle is, if it is suturable, do the suture. There is no word as suturable. Okay, if it is has potential to suture, then please suture it. If it is full thickness injury, very full thickness, and it is almost like it may come off, or it is necrosed or black in colors, you have to go for a glossectomy. The surgical procedure is known as glossectomy. Glossectomy. It can be complete or partial, but most commonly it is partial glossectomy. Partial glossectomy. Okay, so here in this particular case, we can go for suturing all those things. Here you may need glossectomy. Let us see the procedure. Here you can see a procedure for glossectomy. So we have to apply a tourniquet. Then it is a V-shape incision like this. Then you have to suture like this. You can use simple interrupted or you can use horizontal matrix. Remember, when you are putting horizontal matrix on tongue, keep some gap between the sutures, because if you do very close horizontal matrix pattern, then it will cause necrosis. Okay, because it will block all the blood vessels. Now here it is suturable, so it is sutured. Okay, simple thing, no complicated thing, very simple. The thing is, you need some, what is called, courage to do this. Next case is, or next surgical condition is tongue tumor. So in pet animals especially, you will find a tumor known as squamous cell carcinoma. Squamous cell carcinoma. We will discuss about squamous cell carcinoma in next class when we are dealing with teeth and oral tumors. So squamous cell carcinoma, it can affect all the organs in mouth like teeth, gum, tongue, palate, soft palate, all those things it can affect. Similarly, it can affect the tongue. When it will affect the tongue, then you need glossectomy. Okay, you need glossectomy. There is a surgical procedure, that is the glossectomy. So first you have to use stay sutures for making the organ stay, but remember, if you are not using stay sutures, you can hold it with non-crushing forceps. You can use a artery forceps or you can use a Babcock, not Alice. But remember, while holding, put a gauge between the teeth of artery forceps or the Babcock forceps, so that it will be less crushing. Okay, so if these are stay sutures, then you have to think that where you are going to do the glossectomy. Before doing glossectomy, put horizontal matrix little distance. If you are making too close, then there will be necrosis. Then cut the affected part out. When the affected part is out, the lips, the margins are approached with simple interrupted sutures. Okay, understood? This is glossectomy. Next is ranula. Next surgical condition is ranula. Ranula, the other name is, or the primary name is sublingual salivary cyst. Salivary cyst. So this particular ranula topic I have covered in a practical surgery class where I had done a surgery. There is a case report also. Okay, you can check that out, but for this class purpose, so ranula is there. I have discussed all type of mucosals. Okay, we will also discuss mucosals in subsequent classes. You know, don't need to worry. So ranula is sublingual salivary cyst. I told you sublingual salivary caruncles or sublingual caruncles, where the sublingual salivary duct opens. Due to some any reason, the duct can be blocked and there will be accumulation of saliva or fluid below the tongue. Okay, this is basically termed as ranula. So the surgery is known as, the most common one is the marsupialization surgery. Marsupialization surgery. What you have to do? You have to open the cyst. Okay, the inner one is the cyst wall. Outer one is the tongue or the tongue mucosa. Okay, mucosa. So you simply have to suture the cyst wall with the mucosa. Simply you have to suture. When you will do suturing all around, it will create a permanent opening and all those cystic fluids will come out. Okay, this is the surgery for the sublingual salivary cyst. Still, if it is not going out, continuously happening, then you have to remove the sublingual salivary gland. It is not removed alone, it is removed along with mandibular gland, mandibular sublingual salivary ectomy. Okay, sialectomy. So this is ranula. Next surgical condition is cleft palate. Same like cleft lip, this is congenital. You can see here great opening between the palate and the nasal cavity, oronasal cavity. Okay, this is here. You can see here there is cleft palate, along with there is cleft lip along with cleft palate, which goes up to the soft palate. Okay, there is different surgeries for cleft palate. First surgery is known as bipedical flap repair. You can say sliding bipedical flap repair. Okay, this is the first technique. So what you have to do in this technique? So suppose this is the cleft palate, you have to repair. So first you have to make two sliding flaps. Those flaps is known as mucoperiosteal flap. Mucoperiosteal flap. So how to create those flaps? Make incisions close to the defect here and here, another far, another 2 incision far. Now this is a flap, and this is a flap. You have to create a flap under the mucosa. Okay, you can see here a flap, two flaps are created. This one is one flap, this is right, suppose this is left side, this is the right side, this is left flap, this is the right flap. Now two flaps are created. Remember, while making the flap, include the blood vessels. There are two vessels on each side, one vessel here, one vessel here, total two, that is the palatine vessels. So these two flaps will now be joined. Before joining these two flaps, first you have to repair the nasal mucosa. Oppose the nasal mucosa, then the palatine mucosa, it will be repaired. Now you will ask, what will happen to this gap? There will be gap because you are doing flap. These two flaps are now coming to the center and they are opposed. Here will be gap. Okay, so this will heal by primary intention, the primary defect, and this will heal by secondary defect, secondary intention. Okay, so this basically will be left open. Okay, nothing will be done. And regarding healing, I have also made video in general surgery wound healing. If you are not understanding primary intention, secondary intention, please do follow that. Okay, I will give the link to the playlist of general surgery in the description. So this will heal by secondary intention. You can see this is a cross sectional image. This is nasal cavity, nasal mucosa repaired. This is the bone which has a cleft. Now here you can see these two flaps has come to center for the closure of this particular defect, and here some gaps are there. This will heal by secondary intention. Understood? Another surgical method is the Oronasal repaired with overlapping flap technique. Overlapping flap technique. What is overlapping flap technique? This is very small, so I wrote there overlapping flap technique. So what you have to do here? So first you have to, suppose this is left side, right side. So you have to make incision on right hand side close to the defect, and you have to make a flap on left side. So you have to make incision like this. This will be the flap. This will be the flap. Now the flap is created. This is the flap, and here the flap is not created, but the gap is created between the mucosa and the bone. Okay, so what will happen? These mucoperiosteal flap will go under this mucosa. See, this is cross sectional image. So here you have created a gap in this. This is right hand side, this is left hand side. This is a cross sectional image. So this left flap which you have created will go under this. See here how it will go. It will go under this. Then it will be sutured. You see here. Okay, this is a clear image. You can see this flap will go under this flap. Okay, left flap will go under the right flap. This is technically not a flap, but you can say that as a flap. Now it will heal by primary intention, but this gap which you are seeing will heal by secondary intention. Now while you have done the flap of hard palate, in soft palate, if it is going beyond, then you have to give a tension relieving incision. First you have to repair the nasal mucosa. Okay, then after the palatine mucosa. Okay, so you have to give a tension relieving suture. Here you can see a tension relieving suture incision. Tension relieving incision is given. Relief incisions. Okay, given. Then it is repaired. First one is the nasal mucosa. Okay, palatine muscle layer, especially in the soft palate. Then the oral mucosa, which is repaired. Okay, in this way it is repaired, and these relieving incisions will have some gap. It will heal by secondary intention. I hope you understood this. These two are primary techniques. Next is the Oronasal fistula. It is same as the cleft palate, but it is acquired. That is congenital. It is acquired. Most commonly you will find injury to canine teeth. Injury to the canine teeth. When there will be injury to canine teeth, it will open up, that particular infection will open up to the nasal cavity. Or suppose there is dental tartar, too much dental tartar on canine teeth, and it has alveolar periostitis. We will discuss teeth in the next class. Okay, So alveolar peristage, it may go up to the nasal mucosa and it open to the nasal mucosa. Okay, that is the oronasal fistula. Or else suppose the animal was eating some bony bones and it has a very pointy structure, it may injure and cause the oronasal fistula. Okay, so thus signs and symptoms of cleft palate and oronasal fistula is same. Okay, whatever you will eat, it will come through the nose. Okay, whatever the animal will eat, not you, animal will eat, it will come through the nose. So what is the surgical condition, surgeries? There are multiple surgeries, different type of surgeries. First one is the direct apposition. Direct apposition, suppose this canine teeth is lost and there is fistula, so simply you have to make an incision, okay, a circular incision and slightly extend. Simply you will make two flaps, okay, these gum flaps, gingival flaps. Okay, so you have to make two gingival flaps and you have to oppose it. Okay, you have to oppose it. Simple interrupted suture. This is direct apposition. What are other techniques? Suppose there is a fistula, there is known as, this technique is flap advancement technique. Flap advancement, you have to create a buccal flap. Here you have to create a buccal flap like this, and this particular flap will be advanced towards the defect. You see this flap is created, here is the fistula. You have to advance this flap and you have to suture it. See here, they are very soft and elastic, so simply you can put a pressure, okay, then you advance it and suture it. Okay, this is buccal flap. Next is hard palate rotational flap. What is hard palate rotational flap? It is for the when there is a defect on the hard palate. Suppose here is the defect on hard palate, so you have to make a flap here. You have to make a flap here. Simply rotate it and suture it over the defect. Rotational flap. And now this gap will heal by secondary intention. This primary defect will heal with the first degree intention or primary intention, and this gap will heal by secondary intention. Similarly, the soft palate advancement flap. Suppose there is a flap and there is a defect here on the hard palate, you have to make a flap on soft palate, then simply advance it and suture it. Okay, depending on the location. Suppose there is a defect here, you cannot do a soft palate advancement flap. Okay, depends where it is located and how is technique you have to use. You have to use your mind. Okay, suppose here is a defect, then you can do rotational flap of hard palate. Okay, like that. These are techniques. What to use or when to use, it is up to the surgeon, and depending on the condition, surgeon will use. First on the direct apposition, then is the buccal flap advancement, it is the palatine flap rotational flap, here is the soft palatine flap advancement. Okay, so these are the techniques. There are other techniques also. Double flap technique. So what is double flap technique? Suppose here is the canine teeth which has been affected and causing the oronasal fistula. Then you have to make a hard palate flap. Before advancement, during the rotational flap, you have to see here is the defect and here will be gum. Gingival flaps we can do. You can see, remember in the previous slide that there was a direct apposition by doing the gum flaps or gingival flaps. Simply you have to make two gingival flaps, oppose them first, then do the rotational of the hard palate rotational flap. This is double flap technique. Okay, simple, they are simple, not that complicated, but actually doing it is bit difficult. Okay, but you should know all these things. Depending on the situation, you can use it. Next, another technique, double flap technique, is basically, suppose here is the defect. First do the palatine flap here. This is the palatine flap. Simply rotate it, or you can say that overlap. Rotate and overlap it over the defect. See here, it has been rotated. This flap is created here. Simply rotate it and paste it over the flap, the defect. Okay, and suture it. Now another flap will be created, that is the buccal flap. buccal flap. Now that particular buccal flap will be advanced and cover this defect as well as this defect. You can see here, okay, completely both the defect has been covered. This one is the defect which you need to repair. This defect you have created, the flap you have created, both can be repaired. Okay, now you see buccal flap will be elevated and will be sutured. This is double flap technique. Okay, these are basically to repair oronasal fistula. They also can be used for the nasal flap, the cleft palate. Okay, they can be used. Next, suppose you want to use some hard structures. Okay, you can use cartilage flap or cartilage graft. The term is cartilage graft. Cartilage graft repair for oronasal fistula. It is of two types depending from which you are taking the cartilage. It can be conchal ear pinna, conchal cartilage graft repair, or it can be from vertical ear canal. Okay, so these two structure from these two positions from which you can harvest cartilage and you can paste it over the defect. See here, you have harvested from the ear pinna, conchal cartilage repair, and simply what you have to do, simply make incision all around and separate, that is simply you have to separate the mucoperiosteum all around. Okay, then simply put the cartilage and suture it under those, okay, not above, under those flaps, and then repair. Here this technique is same, only you are harvesting from the vertical ear canal of dog, okay, or pet animal. So this is, you can see here, conchal cartilage graft repair, and here the vertical ear canal graft repair. These two are grafts, cartilage grafts, which can be used for the repair of the oronasal fistula. Next, it is a case of bovine, actually, self-suckling. Self-suckling in case of bovines. Sometimes farmer will come to you and he or she will complain that cow is drinking her own milk. Why? How? Because the tongue, this cow, the tongue, you see this is tongue, it is, animal is able to, she is able to make a U shape. For suckling, this is your tongue. For suckling, you need some U shape for suckling. So that particular cow is able to do that. So the surgical, what will be the surgical procedure? It is making it a U shape. If it means it is making a concave shape. If at all there will be a surgery by which this particular length will be convex, okay, then it will not be able to suck it. Okay, suck our own milk. So the surgery aims at to making the dorsal surface of tongue convex. Okay, so there are two types of surgeries. First one is the surgery is known as partial glossectomy. Glossectomy, partial glossectomy. There are two types of surgery. One is ventral glossectomy, ventral. Another one is lateral. So what will happen on the ventral surface? This picture is slightly incorrect. So suppose this is the ventral surface of tongue. Here will be in the middle, there will be frenulum. Okay, so you have to take a length of elliptical, you have to give a elliptical incision. It should be 2.5 cm away from the tip and the width should be 5 cm. So this particular elliptical area you have to do the dissection and remove this particular area. Remember, don't go too deep, you may hit the vessels, lingual vessels. So simply you have to superficially, you have to remove this particular piece. Just you have incision should go here from 2.5 cm distance, just cranial to the frenulum, this length, and this width will be 5 cm. So in this way this particular patch will be removed and then it will be sutured. Remember, this particular portion is removed. When it will be sutured, the tongue will curve. This is ventral surface, the dorsal surface will be convex and the animal will not able to suck. This is one. Second is the lateral. Lateral, actually the tip of the tongue, nearly 5 centimeter distance, the tip of the tongue will be taken out and it will be sutured. It will be slightly like this. What will happen? Again there will be convexity of tongue. The animal, you see there is a tip, so by the tip it is doing the U shape. See here tip, it is doing the, suppose this is the tip, it is doing U shape. If its tip is removed, then it will be difficult to the U shape for the suckling. Okay, these two are the surgeries that is mentioned in book, but there is another technique which I found in internet, which is these are kind of invasive. There is a minimally invasive technique, intralingual suture. Intralingual suture, this is the article. If you want to read, simply search this one in the internet, you will find. Here what they have done is that they have given 4 incisions, 2.5 centimeter from the tip. They have given 4 incisions, 1 2 3 4 incisions. Now they have introduced suture interlingually. How? So they will insert the suture here like this, it will come out, then again it will be inserted, come out C, A B C D. Okay, come out C, then again it will be introduced under, from C it will be coming out through D, then it will be introduced through D and it will come out A. Okay, now all those things will be tightened up. See here the tightening. When you will be doing the tightening, see how much convexity it has done. Then it should not be like too tight that it is, the tongue itself will go like it will thin out. Okay, the width will come like it may reduce up to half of its width. It is not like that. So you have to tighten it till you find some convexity on the dorsal surface of the tongue. This is the dorsal surface. So when you will find this convexity, simply leave it, do the knot. Okay, then these stab incisions or small incision will be approached by one single stitch. Okay, compared to the previous one where you have to remove a part of the tongue, that is more invasive. This is less invasive and effective. Okay, you understood? And this is self-suckling in cows and how it can be managed surgically. Next, the last surgical condition is the buccal fistula. Buccal fistula. Sometimes you may find this particular one in large animals because of their grazing behaviors. They may injure this buccal area and you will find fistula. So simply you have to repair this one while suturing. Remember 3 layers you have to suture. First on the inside one, which is the oral layer, oral mucosa first. Next layer is the muscles, buccal muscles. Last one is the skin. Okay, these 3 you have to remember, you have to suture. And while repairing the buccal fistula, don't forget to freshen up. Okay, because these areas, if you simply suture, it will not heal. And also this particular area, if you look, if you take bite from the sutures, it will not hold the sutures because they are mostly dead tissues or inflamed tissues. They won't hold these sutures. Sometimes you may need to extend a little bit, then do the suturing, depending on that condition. Okay, depending on your expertise, depending on your experience, you have to do. If it is slightly fresh, then do the debridement and suture. If it is more than 2 months or 3 months, you have to slightly extend it, then do the debridement, then do the suturing. So it is up to the surgeon and how he or she has experiences regarding this particular case. But only thing is, the principle is you have to suture like this. Okay, don't do the single layer suture. Okay, you have to suture it in 3 layers. So this is all about today. This is the first lecture. In the next lecture we will be dealing with the teeth, jaw and some oral tumors. Okay, so till then, tata, bye bye, take care.